So I'm going to ask Eliana Monteforte to come onto the stage and share highlights from the COVID impacts paper. Hi, Eliana.
Hey, Elisha. Thank you so much for the introduction. Welcome, everyone. I'm so excited that this event has finally come. And I so appreciate all the people who have joined the platform early and introduced themselves. Please continue to dialogue using the chat. I'm going to start off by saying that we truly wanted to use this paper and this event to highlight the lived experiences of those populations that are so often left behind. And we hear so many numbers all the time, but there's something to be said about an individual's personal strife and experience, which in so many ways demonstrates impact far beyond any number. So we hope that through this paper, we not only summarize a lot of the literature that is out there, and we know that there is so much more that comes out every day, but that we're also providing a space and a place for people to share their voice. I'd just like to quote quickly one of our community focus group participants in saying, there's so much more than the data points we present to truly understand COVID-19. So keeping that in mind, the main purpose of this publication was to highlight the gross inequities, among others, of minority and marginalized communities, especially that they continue to experience throughout this pandemic. And we are also in the paper providing recommendations for how governments and other stakeholders can better support these communities in the future, but also as we continue to address this crisis. I'm going to talk a little bit about how we put this paper together. So it's partially a review of articles and editorials, peer-reviewed journals, opinion pieces, all that focused on the impacts of COVID-19 on minority and marginalized communities. And the time period that we looked at these articles was March 2020 to December 2021. So I'm sure there are a lot of things that have come out since then. I see it every day come into my inbox. So just keep the timeline in mind. But also, in addition to that, we hosted 7 community focus groups with various different populations to capture firsthand accounts and lived experiences that these individuals have experienced throughout the pandemic. And before I continue, I do just want to thank all of the people that I know are here that helped me organize, lead, facilitate, or that participated in those community focus groups, because I truly feel that that information is the heart of what's in this paper. The community focus groups included civil society organizations. We looked at from youth, from the LGBTQI community. We talked to women, people living with disabilities. We had a few in English and in Spanish to try to capture different regions of the world. Each community focus group had between 10 to 15 participants. I should also say that the community focus groups were designed and led by individuals from the communities that we were speaking to. So there was really something special about that. Moving on to the results, what we did is we looked at various cross-cutting issues that seem to have impacted almost all of the population groups that we looked at. And so the results look at 6 issue areas. The first we noted, and I'm sure this is not a surprise to anybody, a link between race and health inequities. The pandemic clearly brought to light and further exacerbated health disparities. We did look at population groups in the US, for example. We looked at African Americans and Latino residents and how they have some of the highest rates of COVID infection and death rates, more than double than those of white residents. So just an example of many of how we've seen this link between race and health inequities. We saw a disruption in continuum of care. We saw childhood vaccinations globally drop significantly. Many health centers were forced to prioritize COVID-19 testing and treatment over normal services all around the world. So other what were essential services were deemed non-essential. That had a huge impact on reproductive health, for example. Abortion was deemed non-essential. We had higher rates of unintended pregnancies, limited access to STI treatment. limited access to HIV and TB treatments. Also, people with chronic conditions were left with limited access to care. And telehealth left a lot of people behind, especially those that didn't have connectivity. So it's just a few examples, and I'm sure we'll hear more from the panel on how COVID-19 impacted continuum of care. We also saw increased in gender-based violence. So lockdown policies led many to have to shelter in place with their abusers. So across women, the transgender community, children, we saw an uptick in violence. And then we also saw school closures, which, as I mentioned, a lot of youth had to stay at home. A lot of children had to stay at home. So we did see higher rates of violence against children. We saw an increase in childhood marriage. I mentioned early unintended pregnancies. Another really important cross-cutting issue that we saw was a rise in mental health problems. And I'm sure you all have probably seen a lot of articles talking about what we should be expecting in terms of mental health and the huge need we have now and in the future in dealing with this issue. So despite having similar rates of mental health illness, Black and Latino populations had significantly less access to mental health services than other population groups. So this access to mental health is an issue. We've seen rises in rates of substance use and overdose. Globally, we've seen women and girls have poorer mental health. Gender-based violence has a huge role in that. Our health workforce has taken such a huge toll, as many of you know. Many of you are in the health workforce, and so firsthand have experienced the toll that it's taken, not just physically, but also mentally. And there just aren't enough mental health services supporting our health workers right now. And youth, because they have been either not able to go to school or have switched to virtual school, have really been experiencing a lot of isolation, which has led to a lot of mental health issues. Next, especially when we spoke to the community of people living with disabilities, we saw that there was a huge lack of accessibility and inclusion in the current COVID-19 response. A lot of the information was just not accessible to this group. A lot of the vaccine sites or even the testing sites were either not wheelchair accessible, did not have appropriate signage or interpretation. We also saw disruptions in education and the workforce. Of course, a lot of people lost their jobs. A lot of women, children are not able to go back to school. And even now that schools are open, we're finding that a lot of them still have not gone back to school. So, that's going to have a lot of social and economic impacts as well. So that's a summary that we'll take a deeper dive into in the panel. And based on those results, we in the paper have provided some recommendations to governments and other stakeholders that could really make a difference for these communities. And I would just like to say here that these recommendations did not just come from us, GHC. They actually came from our discussions with our communities during these community focus groups. We asked them, based on your experience and what your government has and has not been doing, what do you think we should be recommending and telling governments to do? So keep that in mind as we go through these. But number one, governments must ensure the continuum of care of all essential health services during a public health emergency. Two, governments need to talk about and address the increase in gender-based and home-based violence. Included in those conversations should be violence against the LGBTQI+ community. Three, governments and stakeholders must prioritize and fund mental health. Four, all public health strategies must be accessible and inclusive to people with disabilities. And five, governments must provide economic protections and security to the most vulnerable populations. So that, I hope, provides a good summary of the paper. If you have not already read it, we do have a link to the paper And please take your time to read it. And if you have any comments or questions, now's the time to send it through the chat in our discussion.